Hey everybody, welcome to Higher Levels with Shay. I am your host, Shay, a bachelor's degree registered nurse, 3 years of herbalism, 15 years in the medical field. So today our topic is diabetes. So what I'm going to do is I'm going to go over the endocrine system and all that it entails. And then after I discuss the endocrine system and all that it entails, we're going to talk about specifically pancreas. And the reason we're going to focus more on the pancreas because we're obviously talking about diabetes, okay? We all know somebody with diabetes, whether it's ourselves, whether it's a loved one, a co-worker. So I really want to tackle this topic because I feel like a lot of people are going to learn from this topic. Now, as we're discussing diabetes, we're going to talk about some of the causes of diabetes, some of the lifestyle causes of diabetes. We're going to talk about the pathophysiology of the disease process. We're going to talk about how it affects our body. And then we're going to talk about natural or holistic ways to help heal yourselves of diabetes. All right. And lifestyle change that you can make so that you can prevent yourself either having diabetes or decrease the signs and symptoms of diabetes. I love interacting with you all. So if you are just now following my page, what we typically do on here is we go over disease processes. And you could find the recorded and past topics on my YouTube channel at Higher Levels with Shay. All right. So y'all climb in. Make sure y'all share this information. Make sure y'all sharing this show today with other people. Invite them on. Hearted welcome. Thank y'all for coming in. Hi guys. Hello. So diabetes. We get ready to talk about diabetes, guys. And make sure y'all have y'all pens and y'all papers ready. And make sure y'all go to my YouTube channel, Higher Levels with Shay. If y'all want to see the past time, we talked about cancer, we talked about STIs, women issues, male issues, kidney issues, childhood issues. We talked about a lot on those other topics. So today we are going to be talking about diabetes. Okay, so diabetes is before we get to the disease process, let's talk about insulin. Insulin is a hormone that is produced by your pancreas. Your pancreas is part of your endocrine system. So your endocrine system, let's talk about it. It's a complex but a very simple system that helps with your hormonal growth, your cell growth, reproductive formation and growth, and as well as like your immune growth. Okay, so we're going to talk about some parts of the endocrine system. We have the thyroid, the parathyroid, the pituitary gland, the pancreas, testes, gonads, things like that. But today we're going to focus on the pancreas itself. So what is the pancreas? The pancreas is an organ in your body, and one of its functions is to produce beta cells. Those beta cells produce insulin, okay? Insulin is a hormone. So whether you believe it or not, insulin is a hormone. So what happens in diabetes type 1 patients is their pancreas is completely not functioning properly, and they can't produce a lot of beta cells to produce the insulin. What is the purpose of the insulin? The purpose of the insulin is to decrease your blood glucose level, or in layman's terms, blood sugar level, and keep it within normal range. Normal range for blood sugar levels should be anywhere between 80 and 120. Say it's 60. In the past it was 60 to 100, but more so lately I've been seeing that it's more common for doctors to educate patients, and then for myself being a registered nurse, when we're doing our discharge information and education to patients, to let them know it is between 80 and 120. All right, so the insulin is secreted when your body has your body's blood glucose level is out of range. So the insulin helps to bring that blood glucose level down into normal range. Sometimes you can become what is called hypoglycemic. Hypoglycemia is when your blood sugar level is too low. Okay, so it may be too much, not enough blood glucose in your body. Hyperglycemia is when your blood glucose level is elevated and it's too much blood glucose in your body. And we will be talking about what can happen to you when your blood sugar is too low, some signs and symptoms, and when your blood sugar is too high, signs and symptoms, and when it gets extremely high, what could happen and what that does to the brain. So remember in my past show, I was talking about dementia and how dementia is can be seen as diabetes type 3. So we're going to get into that. That's when your blood sugar is just, we'll talk about that soon, okay? So make sure y'all are inviting people onto my live. Make sure y'all inviting them to the High Levels with Shay so they can get this information. It's free information, okay? So the pancreas produces beta cells in your body, and the beta cells helps to excrete your insulin production. And juvenile diabetes meaning children with diabetes, and yes, children can be diagnosed with diabetes. That is called juvenile diabetes. And so they're born with an impairment or a malfunction with the pancreas and with the beta cell production. So what happens with type 1 diabetes or juvenile diabetes is when your body is insulin dependent, meaning that your body is dependent on a synthetic hormone or man-made insulin. Now, you do have all types of insulins. You have short-term acting, fast-acting, and long-term insulins. And so your fast-acting insulin are more so used in emergency cases. So let's say where your blood glucose level is like 2, 3, 4, 500. It's just up there. If your blood glucose is like in the 5, 6, 7, 800s, then more than likely you're going to be on an insulin drip that's given via IV therapy to help get your blood sugar down to a normal range before, you know, further complications or irreparable damages occur. So if you're like 200 or 300, 400, and those are typically for those patients who will check their insulin 30 minutes before every meal. The reason why you want to check your insulin 30 minutes before every meal, or is recommended, is because you're able to see what is your base blood sugar at that time before you eat. Why is it before you eat? Well, when you eat, your body's going to, you're taking in more carbs, you're taking in more sugar, okay? And so that's going to automatically elevate your blood sugar levels, right? And so you want to make sure that when you are administering insulin to yourself or to loved ones, that you're giving them appropriate dosage. So that's why you want to check it 30 minutes before you eat your meal. All right. So when you have type 1 diabetes, you are insulin dependent. That means your pancreas isn't working at all. In a sense that it should be, or enough insulin isn't being produced in your body. So you are one of those people who are dependent on this insulin, this synthetic insulin, fast acting insulin, short term acting insulin, and long term acting insulins. And some of your fast acting insulins could be like Humalog, Novolog. Your short term, your long term is like Lantus, Lantus. Those are your long term, and that's typically given once, no more than twice a day. But mainly it's all predominantly given once a day, mainly at night, and then that sustains for the entire 24 hours, trying to stabilize your blood sugar. And then in between, you know, breakfast, lunch, and dinner meals, you're also obviously taking your insulin before you get your short and your long term, okay? So make sure that you are taking notes, and have your pens, because again, we will be talking about herbs. We will be talking about lifestyle changes that can help alleviate your signs and symptoms of hyper or hypoglycemia. Okay, so I started to make sure I was being very careful with saying the word cure. I'm going to start saying alleviating your signs and symptoms of diabetes. Okay, so now what is the difference between type 1 diabetes and type 2 diabetes? Well, type 2 diabetes is non-insulin dependent. Now, that's not to say that you're never going to have to use insulin in your life with type 2 diabetes, but it's just more so saying that you're able to sustain the symptoms with lifestyle changes. Typically, with type 2 diabetes, that is more so occurs over a lifetime. That happens later on in life. Whereas type 1 diabetes or juvenile diabetes is typically diagnosed early on in life, in childhood or like early adolescence, okay? But then you have type 2, anybody can develop type 2 diabetes. How many of y'all have actually heard of gestational diabetes? Type it in the comment. How many of y'all have ever heard of gestational diabetes? Thank y'all for the hearts. Thank y'all for the hearts. I appreciate the hearts. I encourage the hearts. If y'all are learning anything, if during this entire show, I come across information, you come across information that you've never heard of, I appreciate the hearts. I appreciate the gifts. I appreciate y'all sharing and inviting people on these lives, okay? It said, I used to take the grade night insulin, but I don't take it anymore. That is amazing. All right. Yep. So we're going to go through all of that. Thank y'all for y'all questions. Thank y'all. Thank y'all. Thank y'all. I really appreciate it. Thank you. So if you're learning anything, make sure that you're just sitting hard so that I can know that you are here, so I can know that you are at least gaining the knowledge in which I am trying to give to you all, okay? So, with type 2 diabetes, you're not insulin dependent, and that's actually a disease process in which you can develop yourself with your own lifestyle. Poor diet causes type 2 diabetes. What do I mean by poor diet? Eating oversaturated fats, high cholesterol foods, high sugar intake, especially if it's artificial sugars. I'm not talking about fruits that you get from your grapes and your apples and your bananas. I'm talking about candy, soda, even barbecue sauce is extremely sweet, sweets, processed sugars, fruit snacks, potato chips. I mean, just very, 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 basically just eating garbage. You're just putting garbage into your body and then telling your pancreas to help you to produce insulin so that you can make sure that that garbage doesn't elevate your blood sugar. But what happens is the pancreas get overworked. The pancreas is exhausted. And so they have a test called the HA1C. And that's your hemoglobin A1C levels. And what that is it is a test where you will go to your physician and they will check your blood levels along with your standing glucose level. But what the A1C is, it gives the doctors a range. It can detect your blood sugar range for the past 3 to 6 months, and it'll tell you if you're pre-diabetic or not, depending on your level. So if you are like a 5.5, then you will be considered borderline diabetic. And so if you go and you get tested, and wait, before we get to the test, what are some signs and symptoms? Let me go back here a little bit before you even run and go get tested. So before we get to that, I'm gonna finish explaining type 2 diabetes, and then we'll discuss some signs and symptoms, and then we'll talk about diagnostic studies and tests. So with type 2 diabetes, you can get that from a lack of exercise. Now, why does exercise matter? And when I say exercise, I'm not saying like just going to the gym and working out and having a rigorous workout routine. Even just something as simple as walking or running or treadmill or bicycling. Those are what I consider exercises. Yoga, swimming, those are what I would consider exercising, okay? So if you have a little to no activity besides you're like sitting at a desk at work, or you are a truck driver, or anything that kind of prohibits you from having extra mobility and activities, and you're just sitting, you're snacking, and you're eating junk food, and you're eating fast food, and you're eating fried foods, and drinking soda, and teas, and all these, taking in all this sugar all day long, and you don't have an exercise routine, that can also lead to diabetes. Now, how is exercise and activity linked to you being or the lack thereof is linked to diabetes? Well, when you exercise, your body breaks down fat and it breaks down sugar to produce energy so that you can be able to continue to do the exercise that your body is telling you to do. So when you exercise, you're actually lowering your blood sugar naturally. This is why if you're a diabetic, they'll tell you, swiftly, do not take your insulin and then go swimming. Do not take your insulin and then go running and doing a rigorous exercise, especially if you're not going to make sure that you're being properly nourished and fed, because your blood sugar will drop, and then you're going to be having something called hypoglycemia. And that's when your blood sugar is like less than 60. Now, what happens to the body? Now we're going to get into, thank you so much. Somebody said this is very true. Yes, it is. So now we're going to get into some signs and symptoms of hypoglycemia and hyperglycemia, and then we're going to go further into the disease process. So what happens if you are not a diabetic, but you are out in the great summer and you're playing softball, basketball, and you're drinking sips of water, but not much, and then you start feeling lightheadedness, you start feeling nauseous, you start feeling dizzy, you start feeling lethargic. Lethargic means very sluggish. Your memory focus is distorted. You can't even really get words out properly. You start to talk jumbo. That is a sign of hypoglycemia. You're out there running, you're not properly hydrating yourself. Even if you're not a diabetic, this can still happen to you. So this isn't just diabetes, this is everybody I'm talking to right now who's on this live. Thank all of you all who are tuning in. So you want to make sure that diabetes or not, if you are going to be doing any extra strenuous activities, make sure that you are properly eating and make sure you are properly hydrating yourself to make sure that you are able to replenish yourself with whatever nutrients and minerals that you're losing during those activities, and sweating and your body fat loss and your blood sugar loss. Because like I said, your body is going to eat your fat and your body is going to eat the sugars in your body, and then to help to maintain your energy. Why is it that you become like lethargic? Why is it that your brain starts to become foggy, or you start to have like blurred visions and you're murmuring words? Well, here's a really great gem. I'm gonna tell y'all right now. A lot of people don't even know this. Sugar. Your brain is one of the main organs that needs sugar in order to continue to move forward. I'm going to say it again. Your brain is the only organ, the main organ, that requires sugar in order to maintain its purpose. So, if your sugar level is low and your brain doesn't have sugar, that's when you start having a blurred vision, or you start having the gross motor issues, the fine motor issues. You can't even really talk. That is what's going on. Your brain is shutting down. That's what's happening. And then if you're at home, you know, some people get like sugar packs and try to put it underneath the tongue. And why do you put sugar packs underneath the tongue? Now, this is for somebody who is still awake and is a little bit lethargic. So this is for anybody who's not in the medical field and you can't get to any glucagon, or you can't get to any herbs, you can't get to any orange juice. And the reason why I'm saying this, I'm going to give y'all this gem, because if somebody's blood sugar is low and they are kind of like passing out, you don't want to pour orange juice down their mouth. You don't want to stick a banana in their mouth, because they're going to aspirate, meaning they're going to choke. So one of the things that I will teach y'all right now is sugar packs. You put sugar underneath the tongue. Why underneath the tongue? Because the tongue has a lot of blood vessels underneath them and salivary glands underneath them, that it absorbs the sugar a lot quicker to get through your bloodstream, and then that'll help bring the blood sugar up. So you put as many sugar packs underneath there until they're able to at least wake up enough to be able to start drinking orange juice. Orange juice. The ascorbic acid and the fructose and the galactose in the orange, not the galactose, the fructose and the glucose in the orange juice will help to shoot their blood sugar up significantly. All right. That is for diabetic and pre-diabetic. Thank you so much for the hearts. I really appreciate it. Thank y'all for the support. That is for non-diabetic and diabetics. Now, for those who are diagnosed with diabetes, you in the comments tell me that if these were some of the signs and symptoms that you was experiencing prior to you going to seek medical assistance. And for anybody who is starting to experience any of these signs and symptoms, then I need you to go and get your A1C level checked immediately. If you are having increased thirst, where you're always thirsty, if you are starting to have slow healing sores and cuts, unexpected weight gain, fatigue, increased hunger, and increased urination. Now you're always thirsty, you're always hungry, you're always having to urinate. Every time you get a sore or a cut, all of a sudden it's taking you start to know that it's taking a lot longer for the healing process to begin for that cut. You're tired all the time. You feel a hormone imbalance. I need you to make sure you go see the doctors. Y'all want to see the screen. That's frequent urination. So if you are now, make it clear, if you just have like one of those symptoms where you just, let's say you're always thirsty, then I'm going to ask you, my question to you would be, what is your sodium intake? You know, like, because I'll tell you now, wherever salt goes, water goes. So if you're consuming a lot of sodium, that's fast food, fried foods, spicy chips, chips, if you're consuming a lot of sodium in your diet, then you're always going to want to be thirsty, because your body is going to want to make sure that you're in balance. The water is going to go where the salt goes to dilute that salt, so that you don't have high blood pressure. Okay, you see what I mean? And to make sure the kidney function is proper, because you do have a sodium potassium pump in your kidneys to help with that balance. All right. So, if you have those signs and symptoms, and I mean like more than 2, like I'm always thirsty, and I'm always hungry. I'm always hungry, and my cuts are healing slowly. Then go to the doctor. You see what I mean? And ask them if they could test you for diabetes. Unexpected weight gain. The unexpected weight gain is going to be because of water, like water retention buildup, because like I was telling you about the sodium, okay? So when you go and get your A1C levels checked, you want to make sure that you do not eat anything after midnight, because you don't want to go get your A1C levels checked. Let's say you eat breakfast in the morning, your appointment's at 9 a.m., and then you go and get tested. It's going to give, well, your blood glucose is going to give false high. Your A1C is going to be more accurate, because like I said, that is 3 months, you know, it gives a duration of 3 months of where your blood sugar has been. And that is on like a small scale. So if you like between the 5 and the 5.5, 5 and the 6, then that is pre-diabetic. If you're 6.2, 6.8, 7, then you are considered diabetic. If you are less than 5, then you're not a diabetic, okay? So at least you know you did the homework to go get yourself tested. All right. So before we get into, you know, some lifestyle causes, some lifestyle changes, before we get into the next step, which I want to talk about diabetes type 3, do I have any questions so far? And thank y'all for coming on this live. And please feel comfortable to, if you want to join in on the live, to just give your testimony. Meaning, if you've had diabetes and you did a certain lifestyle change that helped your diabetes alleviate itself, you no longer have any signs and symptoms, you're no longer insulin dependent, then please feel free to come on up here and share your story. Is it true by drinking alcohol can lower your blood sugar? I haven't heard, I've never heard of that. I never heard of that. Now, I will tell you that drinking alcohol thins your blood. You know what I mean? But I don't know about alcohol decreasing your blood sugar. I myself personally, I have never heard of that. I eat barbecue chips and grilled cheese and McDonald's chicken nuggets. And then how do you feel? So by you stating that in the comment, and I appreciate your comment and I appreciate your authenticity. So when you're saying this, what does that mean? Then you said, I drink Sprite. Oh, I drink Spirit and Coca-Cola. Did you mean Sprite or Spirit? Spirit meaning alcohol. So when you say I drink Spirit, are you saying the actual Spirit as an alcohol, or are you saying you drink Sprite? Then you said I drink Mountain Dew. Are you a diabetic? So I see you putting your diet in there. So what is going on with your body? What are some of the signs that you are experiencing? Are you experiencing no signs and symptoms with this diet, or are you starting to have some concerns with this diet? And while you're typing your response in the comment, I will say this. Because I had somebody on my live yesterday, and yesterday we were covering, God, what did we do yesterday? We were just covering female reproductive systems and male reproductive system issues like PCOS, fibroids, cysts, infertilities, males with erectile dysfunctions. We were covering a lot of that stuff on yesterday. And as one of the commentators said, you know, this is a certain lifestyle, a certain diet I eat, and I haven't had any problems, and I'm 34 years old or something like that. I think she was 34. And my rebuttal with her was, nothing is a problem until it becomes a problem. You see what I'm saying? So while you're typing your response, I will say this. If you're not having any issues, do still take advantage of this information that I am giving you, because you should want to start reconsidering your diet and at least start educating yourselves enough to know. And it's just about making a well-informed decision. So educate yourself enough to know that that lifestyle can lead to this disease process, and it can be reversed by changing your lifestyle and readjusting your diet and your level of activity. So I will say that. You said I drink regular lemon lime Sprite. All right. Thank y'all. Welcome to Higher Levels with Shay. Somebody said, what is this lab? This is Higher Levels with Shay, and I am a bachelor's degree registered nurse. I've been doing this for over 15 years. I'm a certified herbalist. Make my own medicines. I grow my own foods. I grow my own herbs. And 3 times a week I go live where we talk about different disease processes. And so this is 3 times a week I go live. We talk about 3 different disease processes, and we give herbs herbal remedies, holistic remedies, and cures to how to alleviate yourself of disease processes. In the past, we've discussed cancer, we've discussed kidney issues, lymphatic issues, we've discussed reproductive issues, fibroid cysts, PCOS, males, erectile dysfunctions. We discussed issues with right now we're doing diabetes. So we discussed a lot of different things on our lab so far, and right now today we're discussing disease. We also did autoimmune disease, where we cover fibromyalgia, lupus, multiple sclerosis. I mean, the labs were just amazing, and we got a lot of great responses. And so we tackle a lot of things here on Higher Levels with Shay. And when you follow my page, I'm giving away grant gems. I'm talking about building your self as an entrepreneur, how to build yourself as whether you're going in school, holistically, and just spiritually, and building your spiritual wealth, because I do go live on Friday mornings and we do our prayers. So that is what you're tuning into, and thank you for tuning in. If you are interested in my previous recordings, they are on my YouTube channel at Higher Levels with Shay. Do feel free to share those labs with others, and just go back and watch them and see what you can learn from them. Because when we're doing these labs, and I know we're talking about like a specific topic like diabetes, somewhere in one of those shows we end up talking about something else, and it'd be so organic connecting with you all that we talk about something else for a brief moment, and even more gems come out, because it's like that was a serious, genuine conversation between me and my family. You all are my family, okay? So let's get back to these questions. But when my blood sugar is high, I get headaches and get tired and I get dizzy. Absolutely. So we definitely gonna get into the signs and symptoms, because those are signs and symptoms of elevated blood sugars as well. All right, so let's see. Vegetables, taking my herbs, and exercise. Amazing. Congratulations. I'm glad that you reversed. Somebody said they ate vegetables, take their herbs, and they started exercising, and then they alleviate themselves the signs and symptoms of diabetes. And you could. This is not a lifestyle sentence. You know what I mean? Like, it's not once I get diabetes, I'm stuck with this for life. It could be with the lack of knowledge. You see what I'm saying? It could be for you if you don't know how, and you go to your physicians and they constantly putting you on different insulin regimens, or they putting you on oral medications like metformin. And it's like, just simply tell them to change their lifestyle. Simply tell them to exercise more. Simply tell them to take herbal medicines or herbal remedies like greater burdock that'll help naturally decrease your blood sugar. Garlic is a natural decreaser of blood sugar, and things like that. And yes, I get it. I'm in the medical field. I've been there for 15 years. So I do know that you can educate people as much as you want, and it's still going to be up to them. They're still going to live the lifestyle that they live. But I push and push and push this knowledge, because one day the seed is going to be planted. One day they're going to be tired of sticking themselves not once, not twice, but multiple times a day. Because you got to stick yourself to check your blood sugar, and then you got to stick yourself to give yourself the insulin. So at some point in your life, you're going to be tired of being a pincushion. And you're going to realize that if I just stop eating this steak, if I stop drinking this juice, if I stay at the fast food restaurant, then I will be okay. And listen, you can do it in moderation. Nothing happens overnight. Don't be too hard on yourself. Give yourself some grace. All right, let's get into some questions. I see some more questions here. I have been getting a little more fat with eating fast food and homemade foods. I've been tired of doing it. This is true. Oh, it's blood sugar. But when my blood sugar gets high. All right, so let's get into those signs and symptoms, because these are some great comments. Thank y'all for commenting and engaging. It says, I have been getting a little more fat with eating fast food and my home cooked meals. All right, so let's get into it. And I'll tell y'all, so y'all in the comments asking me for herbs. Y'all tell me, does this tea work? Y'all tell me how to reverse it. We're going to get into it. But I do want to make sure that I address the signs and symptoms of hyperglycemia. And so somebody said pounding headache. That is absolutely the sign of hyperglycemia. You got to understand, when you got all this sugar in your brain, think your brain is hyperactive. It's in a hyperactive state. Think about it, the equivalent, you give a lot of sugar to a child. They're bouncing off the wall. You can't get them to sit down. So your brain is doing the exact same thing, and it's pulsated, it's overworking. Of course, you're sending your pituitary gland. So it's sending signals and everything to your pancreas, telling your pancreas to produce more insulin. So not only are you overworking your brain, you're overworking your other organ systems as well, organisms as well. So I'll tell you like this. Once your brain is overworking, you're having all these pounding headaches, your pancreas is trying to overwork, your whole entire endocrine system is trying to overwork itself to bring that blood sugar down, you're going to start having fatigue because now you're tired. Now you're exhausted for trying to save yourself. Your body is a self-healing and self-saving organism. And so it's trying to save itself. So a lot of these signs and symptoms that we see is actually our bodies trying to save itself. You see what I'm saying? It's a defense mechanism. All right? So high blood sugar, you're going to be having blurred vision as well. And I'll tell you right now, high blood sugar can lead to crystallization in your retina and in your vessels behind your eyes. And that's what leads to blindness and glaucoma. Sugar in your eye is called glaucoma. Sugar in your joints sugar and acids in your joints is called gout. Okay? Sugar can cause glaucoma and blindness. I want to make sure I say that. Sugar in your mouth is called a cavity. Too much sugar in your bloodstream is called diabetes. All right? And when you have diabetes, more than likely it will lead to cardiovascular issues. How does diabetes lead to cardiovascular issues? Not only is your body overworking itself, trying to heal itself, but glucose is sticky. It's sticky on the inside. It is sticky on the outside. So with that sugar, all that sugar in your bloodstream, think about how thick and sticky it now is. And it's sticking to the wall vessels. So now you have the sticky substance in your wall vessels. And then what's going to happen with the other blood trying to go through? They're going to be clumping and sticking together. Now you have clogged arteries. Too much sugar. Now it's hardening of the arteries. Now you have improper blood flow. Now your heart's trying to overwork itself. Now you have a heart disease. Now you have high blood pressure because your heart is overpumping itself, trying to get this sticky, thick blood through the body. And now you're having heart issues. You see what I'm saying? So something as simple as I'm going to, not work out. I want to just hang out all day, sit down, and eat fast food, eat junk food, YOLO, I could do it. It's going to lead to not one, not two, but three, but four different disease processes. Now you got cavities in your mouth. Now you got to go to the dentist. Now you got a dental infection. How can you die from dental infection and cavities in your mouth? It's because of the toxin in your mouth is going to get to your bloodstream. You have nerve endings and you have blood vessels in your gums and in your teeth. So you got diabetes and poor eating habit cause diabetes, cavities, or oral decay. It can cause high blood pressure, brain fog, blindness, and don't even get me started on one of the main things people see the most. Wounds, cuts, amputations of the toes, amputations of the fingers, amputations of the limbs. Now, how does diabetes, how did one burger lead to 10 burgers, lead to 50 burgers, lead to this? Well, I'm going to tell you. When you mess with the cardiovascular circulatory system, now you're messing with the oxygen flow and the blood flow. And we all know our red blood cells are the nutrition of our body system. So it supplies us with oxygen. It provides us with our nutrients. It provides us with our water. It provides us with everything that we need. Blood supplies every single organ in your body. So if you are prohibiting that blood flow and you're blocking that blood flow with that sticky blood, that sugar in that blood, then guess what? When you have a wound, it's harder for that wound to heal. It's harder for it to heal. It's not a proper oxygen, it's not proper blood flow to that area in order for it to heal. Now that wound is taking a slower time to heal, and so when it's a slow healing process, it leaves a lot of room for bacteria build up, germs to be inserted, because now the skin is broken, now it's open, and now here comes an infection. So now you have an infection. And if that infection can't get healed up quick enough, because let's face it, especially with diabetics, once you have a wound and once your wound is infected, it's almost impossible to get it to close back up and go back to, it's like, oh, why open up that box? You see what I'm saying? And so now you have this wound. Now the wound is infected. It's taking longer to heal. The wound is getting bigger. And now it can lead to something called gangrene or necrosis. Necrosis is dead tissue, where it's black all around the wound. And now you have like gangrene. You're barely getting any blood flow to it. You're not getting any phytonutrients to it. You're getting all this wound care treatment. It's just like, it's now you got a wound vac. I mean, it can lead to a lot before we lead to amputation. You see what I'm saying? And so for the person in the comments that are saying like you're in your diet, and I appreciate your authenticity, because I'm sure you're not the only one that's with that diet. We've all been there or are there. And so we want to be very transparent here. And so I will say this is, if you are in your 20s, in your 30s, or your 40s and 50s, you on this live and you like, I've been eating all my life, nothing ever happened to me, then consider yourself extremely fortunate, consider yourself extremely lucky. But do understand that your eating habits is your responsibility, and it's up to us. We have to take full accountability for what we put in our bodies. Our bodies do not attack us, we attack our bodies. Our body wasn't born with a wound that can't heal. Our body wasn't born with a 500 blood sugar. So it's like we have to take full accountability for what we're doing with ourselves and in our bodies. Okay? So too much blood sugar in your body. What happens is your body begins to form something called ketones. Because now you're going to get into ketoacidosis. Diabetic ketoacidosis. And that's when your blood sugar is like 700-800, and your body is in a very acidic state, because you got to have the alkaline acid base balance, and now it's extremely acidic, and that is extremely dangerous, because that's, if you was here in the beginning of the lab when I was talking about the insulin drip, this is where we're leading up to. When your blood sugar is so elevated that your normal short-acting, long-term acting insulin regimen isn't working anymore, and you're still not changing your lifestyle, now you put yourself into diabetic ketoacidosis, because these ketones are being formed in your body. Your body is trying to save itself, and guess what it starts pulling from? It starts pulling from your lungs. And so when it pulls your lungs, all of a sudden you have this fruity smelling breath, like you've been eating juicy fruit. You see what I'm saying? So sweet urine. And no, I'm not telling anybody to go drink any, but you can smell the sweetness. You can smell the sweetness in the urine. You can smell the sweetness on their breath. That is dangerous. That is extremely dangerous. So if you are having those symptoms, you see what I'm saying? Then I highly encourage you to go seek medical assistance, okay? Somebody said, how would you recommend Ozempic? If you are a diabetic and your physician prescribes that to you, then, hey, if you are not a diabetic, I absolutely, okay, y'all my family, so I'll just be real with you, right? If I could be real with y'all, just type a heart or type a yes in the comments, because can I get real with y'all? Can I be honest with y'all right now? If I can be open, if y'all want me to stay just educating and keep going along, then I won't say nothing. But if I could just be real with y'all, can I just be real? All right, listen, I'm going to be real. I don't recommend Ozempic for nobody. And I'm explaining to you whether you're a diabetic or not. Ozempic causes what is considered hard, like rocks, like stone stomach. Ozempic makes the lining of your stomach extremely hard and shrivel up to the point where you're now throwing up and you can't digest your food properly. It is called stone stomach. That is not something that is just willfully given to the patients, whether you're a diabetic or not. But a lot of people who are on Ozempic, whether you're a diabetic or not, they end up developing not only kidney issues, but they end up in the hospital needing surgery from what we call in the medical field stone stomach. So I don't want to get on this live and say, okay, well, you're a diabetic. And I got to be real. I don't recommend it at all. That is why on this live, you're going to get these natural remedies and these natural herbs and these fruits and vegetables and these lifestyle changes I'm going to give you. So, to answer that question, I don't recommend it at all to nobody. I don't. But for those who are diabetics, if your doctor prescribed you Ozempic, then I highly recommend you do your own due diligence and you look into it yourself and you understand what are the long-term effects of this. And what I mean by long-term is it don't take that long to develop the stone stomach. It does not take that long. So, take it at your own risk. Do your own research. For those who are taking Ozempic for weight loss, I strongly recommend for you to stop. It is so easy to lose weight by cutting out the fast foods, the red meats, the pork, the beef, the sodas, the alcohol. Watch how much weight you lose significantly by drinking spring water. Drinking your spring water and eating your natural herbs and eating your natural foods. And watch how much weight you lose just by your lifestyle change before you go and take this Ozempic. I had somebody who was like, oh, my friend taking Ozempic now, she look good, she look good. And I just, you know why? And in that sentence, everybody isn't open-minded. You know what I'm saying? And so you got to be very careful with who you share certain information with. And so some people, you'll be like, that's not good, I don't recommend that. And they'll listen. And then you got other people saying like, oh, no, this is my life, leave me alone. And he's like, okay, yes, ma'am. Just do your research. So please do. Okay? Please do. Any more questions? Any more questions before we get into this? That's a good question. Somebody asked, is protein shakes good or bad? It depends on the protein. Amino acids, simple amino acid is actually considered a protein. So, if you are taking, and you can get that from your regular natural fruits and vegetables. So, if you are, look up like high protein foods. And so, if you are making your shakes with high protein fruits and vegetables, then absolutely not, it's not bad for you. But those powdered synthetic protein shakes, I would not recommend those. I mean, it's synthetic. It's synthetic. You see what I mean? It's not even real. It's not real. So, amino acids from your fruits and vegetables protein shake, yes. The powder protein shake, I don't need, turn that product around, read the ingredients on the back, and if it has anything outside of like natural fruits and natural vegetables, then I wouldn't recommend that. If there's a lot of chemical words, big words that you don't even pronounce or can't even identify, well, what is this exactly, then I wouldn't consider that a true protein. You can get that from your green leafy vegetables. You see what I'm saying? So, a protein shake made naturally, organically from home with coconut water or distilled water, absolutely. But those, but the fake man-made ones, no. I wouldn't. Get you some natural spring water. Natural spring water. And the issue with a lot of those fake proteins is because they lead to acid buildup. And that's the point. You don't want your body to be in an acidic state. Now, does it help with muscle buildup? Yes. You're going to look great. You're going to feel great. Let's say you're working out, you're drinking all these protein shakes and all these smoothies, and you got your big old box of protein mix, and you doing all that, and you feeling awesome. It's like looking great for right now, but then that long-term effect when you're having gut issues. You see what I'm saying? And gut issues leads to brain issues, memory issues. And so it's like, yeah, you look good and you're all toned up and you all muscular right now, but what they don't tell you is how you're going to be affected in the end later on in life. And so I believe in starting now. I don't have any, by the grace of God, to glory be to God, I don't have any disease process. I remember being younger and I was diagnosed with bronchitis. Changed my lifestyle around. Let go of all the acid buildup that was causing acids around my bronchial tubes, like dairy, like red meats, and a lot of juice. And pork. Once I let that go, I haven't had a bronchitis attack. I haven't had an anxiety attack. I lost a lot of weight. My skin has gotten clearer. I look years younger, you know, because I was becoming overweight. I was like 183 pounds. I'm 5'3". And I was 180 something pounds, looking like a zero. And I was like, woo, that's a lot of weight. My joints were hurting me like crazy. I always had back aches. I always had shoulder pains. But the moment I started losing the weight, bronchitis attacks gone. Doesn't need any treatments or anything. Weight fell off before I even started working out. Skin became clearer. My nails started growing more, even though I cut them down because I hate long nails. But nails started growing more, everything. So any more questions? I see a lot of questions coming in. Let me see here. Oh, absolutely. Thank you. You look good. What is your daily regimen? I absolutely would tell you. Hi, how are you? Thank you. She said I look 23. I'll take it. What do you think about alkaline water? Here's the thing. Alkaline water is mineral dense water, and it's mineral based water, so it puts synthetic minerals into the alkaline water. That's why I highly recommend spring water. Now, with the spring water, it is natural spring water. There's no added additives or ingredients in natural spring water if you do your research and actually look at the back of the water. So with the still water and you're drinking it, your body's going to naturally go into an alkalinic state. Your body's going to naturally do it. It's going to be a natural detox. It's going to naturally go into homeostasis. So you don't have to drink alkaline water to put your body into an alkalinic state, especially when it's a synthetic substance and minerals that they're adding into the water. It's like, if I just drink distilled water, spring water, not distilled. If I just drink spring water, if I eat my fruits, if I eat my vegetables, if I, make sure that even if it's just walking, even if it's just riding a bike for 20 minutes, if I do that, my body's going to automatically go into an alkalinic state. I don't have to drink an alkaline substitute to get my body into an alkalinic state when it can naturally do so on its own by me just doing what my body naturally is supposed to be doing, like me taking care of it from a natural standpoint. You get what I'm saying? I hope that answered your question. What is good for knee inflammation? Inflammation only comes when it only happens when there's a lot of acid buildup, or if there is a like an injury or added pressure to it. Weight can cause knee inflammation. Acid buildup can cause knee inflammation. Injury can cause knee inflammation. So all that can be changed with your body going back into an alkaline state, and when I say alkaline state, you're going to lose the weight. So you're not going to have all that unnecessary pressure on your joints. You see what I'm saying? Now, let's get into it. Because now y'all asking all the right questions I'm going to get into right now. What changes would I recommend? First off, then when I say these changes, I do not expect anything to happen overnight, because I didn't. I did not do it overnight. I had to stop eating beef first, then pork next, then, chicken, then turkey, then I had to titrate myself down. And I still eat seafood. So that's one thing I do eat, is I still eat some seafoods. I let go a lot of pastas. I let go a lot of dairy. So a lot of dairy is acid buildup. Pastas is acid buildup. Red meats, that's all type of beef, lamb, whatever, deer, whatever it is. It's not good for you. We're not supposed to be consuming meat in the first place. Pork is just, that is one of the most, if you can let go of anything first, let go of pork. Pigs were designed to eat the garbage of the earth. So pigs are extremely toxic in their bloodstream by nature. Pigs are extremely acidic on purpose. It was designed that way because their body could sustain a lot of the toxins. You see what I'm saying? So when we consume pigs, we're eating all of the toxins that it ate from the earth, from the garbage, from the slough, from the mud, from the water. So if you can let go of anything first, stop eating pork. If you can let go of anything second is stop eating fast food. It's not even real food. It's man-made, it's synthetic, it's not even real food. It's 3D printed, it's everything, it's not even real food. So pigs first, processed food, like chicken nuggets, chicken sandwiches, these famous chicken sandwich places, and all these burger joints, and it ain't even real beef. It's the fries ain't even real French fries. You can leave a French fry on your car, because I done did it before in the past on accident. I done left a French fry. Make it clear I ain't ate fast food since 2014. And this is the reason why. And there was a fast food chain. I used to love going to get their frappes. They had a chocolate frappe. I love going the summer. It was just delicious. Hated the burgers because the burgers started making me really sick. And then the chicken sandwiches started making me really sick. But what I would go to, I was still going, patronize there. And I would get they frappes, and I would get their French fries. And one day I left the French fry fell on my car somewhere. And I went to go clean my car and shop in my car. And I found this French fry underneath my driver's seat, looking brand new, like I had just bought it. But meanwhile, if I go and purchase a potato and I cut my potato up, it instantly starts, once it starts to hit the air, because once the oxygen, hits the potato, it immediately starts to turn like this brownish color, like it's, like it has to be in cold water. If you ever cook like a real potatoes, you got to put it in cold water. And for it to have turned that fast, but this French fry had been there forever, it's utterly disgusting. And then I was doing even more further research on a lot of things, and a lot of the crop, when they spraying this stuff on our foods and our fruits and vegetables, the people who, I won't call them farmers because it's not even real food, it's so genetically modified, but the farmers who have to spray these chemicals on the food, they have to wear like some hazmat suits. Google this. I'm not making this up. I want y'all to Google this for yourselves and come back and tell me I'm lying. They got to wear these hazmat suits, and they are told that they can't go out into the field for 3 to 4 days. What is it that you spraying on our food to where we can't go, that your workers can't go out into the field for 3 to 4 days? And they got to wear a hazmat suit. See, if it was organic and it was natural and it wasn't toxic to the body, then that shouldn't be a problem. Then there was another documentary that I watched, and it was it was in a rural area, low income area, and they had built this like this crop field, and the crop field they said this stuff once a week, and it was disgusting. Mind you, it's right there next to neighborhoods, next to houses, and they would use an airplane to spray these chemicals on the crop. And then it's like this orangey brownish substance that's floating in the sky for like 2 or 3 days. Tell me why 99% of the people that was in that neighborhood had asthma or bronchitis. So it's not like, oh, that's genetic, it's because your mom has no. And I tell people this all the time. 99% of your diseases are not genetic. It's more of a cultural thing. It's where you live. It's your lifestyle. So if you have diabetes because your mom had diabetes, I'm 100% sure that it wasn't because of genetic. It's because y'all eating the same foods, y'all in the same area, y'all in the same neighborhood, eating the same fast food, doing the same lifestyle, barbecues, doing whatever y'all doing. I know it because I've been there. You see what I'm saying? So I want to make this clear. All right? Let's get back to the comments. Hello, how are you? When I drink alcohol, it makes my sugar so high sometimes. Yeah, see, somebody asked a comment like, does alcohol lower the blood sugar? I've never heard that. And then you're saying it heightens your blood sugar. For me, I know for a fact that alcohol causes your blood sugar to increase. I've never known for it to decrease it. Let me see. I'll get to that. She said, what do you think about Celtic salt? I love pink Himalayan salt. And if you're going to drink water out of a bottle, make sure that it's BPH free. I have to eat more fruits and vegetables. I'm 132 pounds. Okay. I'll tell you like this. Whoops. I don't know what's about to happen. Okay. Well, good. I see y'all comments. All right. So I'm going to answer a couple of questions because y'all asked some really amazing questions in the comments. Some really amazing questions. So we're going to get to some of these herbs and some of these natural remedies. So somebody asked a question about Celtic salt. I actually never use Celtic salt, but I do love using pink Himalayan salt. So what I would recommend for y'all to do is cut down your sodium intake. So, and stay away from white foods like flour. Instead of using like the white bleach enriched flour to fry your foods, or you know that's your choice, then I highly recommend you're using like tapioca flour. Tapioca flour. I use tapioca flour. I use pink Himalayan salt. I use sugar cane. I use raw honey. I do not eat fast foods. I do not eat beef, pork, turkey, and all those. It's not even real food. I can't stress that enough. I can't stress that enough. For those who don't have to go to the gym, even simply is walking 15 minutes a day. Walking around your neighborhood, walking around the grocery store, walking around your park, riding your bike, swimming. All of those things are going to lower your blood sugar, and it's also going to prevent you from becoming diabetic. Again, for disclosure, if you are diabetic and you took your insulin, I highly recommend you to wait 2 or 3 hours before you do any workout regimens, because you're going to decrease your blood sugar even more. Okay? Natural spring waters, I recommend that. Alcohol, prohibit. Drug use, prohibit. So no alcohol use, no drug use, no fast foods, no meats. I won't recommend y'all eating that, the beef, the pork, the lamb. And when I mean by processed foods, I say fast food and processed foods, I'm talking about like those canned tunas, or like the noodles, the raviolis, those things. I say processed foods. Okay, stay away from processed foods. All right. You do those things, then you will start to see your signs and some of the diabetes start to alleviate. All right. I have some more comments here, and I want to make sure I get to every. Yeah, well, where are the kids going to go for their vitamin D? Oh, that is amazing. She says, well, if there's no dairy, then where do the kids go for vitamin D? That is an amazing question. I'm so glad you asked that question. I'm happy to answer that question. For vitamin D, you get vitamin D from one of the best sources in the world, and that is the sun. That is the sun. You should do at least 2 hours of sun a day. Not only does sun detoxify your body, it also increase your serotonin and your dopamine. It also helps your cells to break down toxins. It makes your cells shake and shiver so that it can relieve itself of toxins. It increases the fluid around your cells, so it's making your cells stronger. It's boosting up your immune system. It's relieving yourself of negative energy when you put your feet out there in that grass and you let that negative charge from your body go back into the earth, and the sun is replenishing you with positive protons and neutrons. So for vitamin D, the sun is the very best form of vitamin D ever. Then you want to go to your omega-3s. Because when it comes to dairy, I have to be honest with you, that stuff is synthetic and man-made too. All these white milks, Google how white milk is made. Look at a video of white milk in a factory. And look at how it comes. When it comes from a cow, did you know that when you first milk a cow, it's coming like pinkish, yellowish? Because it's a lot of the fat from the breast. And it's a lot of the like pustules from the breast and from the cow's nipple. And then they put it in the factory and they pasteurizing it, and they taking out natural substance from it, adding their own additives to it. Look at how milk is produced. Because I don't want y'all still thinking that milk today is they just going there hooking up this machine to the cows and milking the cow, and it's going straight to the jug. They have whole milk farms and milk factories. They do a lot of processing to the milk before it hits those jugs, and then before it hits those grocery store shelves or refrigeration. So that's not even real dairy, and it's synthetic. Cheese isn't even real cheese. Yogurt isn't real yogurt. You see what I'm saying? And so I highly recommend you to start putting your children out into the sun as you are getting out there into the sun, and B, and I know this is far-fetched, but if you could, then you could have your own cows, have your own goat, milk your own cow. But for me, I don't give my children that milk because they're not cows. They're not goats. So why would I feed them something that came from an animal that was supposed to feed a 2-ton animal? Because calves are 2 tons. And if my baby is 6 pounds, 4 ounces, or, well, you're not supposed to give them milk until they 1, according to the doctor. But if they 10 pounds, why would I give them this milk with all these steroids in it and all these hormones in it, all for the vitamin D? Why don't I just give them the vitamin D? Why don't I just give them avocados? Why don't I just give them nuts? Why don't I just sit them out there into the sun? You see what I'm saying? Fast food is the enemy. Let me see. Oh, that's good. A lot of people say they use Celtic salt and they really love it. They need to make fake food because we're running out. They don't need to make fake food. They need to allow people to make their own food. And you go out there and garden your own food. And then start teaching agriculture back in elementary and high school. Instead of everybody simply learning trigonometry, geometry, geometry that ain't even being used today, how about you teach them agriculture, farming, how to cultivate a land, how to grow, how to even buy their own land, how to be more self-sufficient. So they don't need to make more food. They need to allow people to be able to grow their own food. Or with me, like what I'm doing, is I'm going to get on here and I'm going to teach y'all how to grow your own foods. That's going to be one of my lives. How to grow your own food. How to make your own tinctures. How to make your own medicine. Because what I found what happened back in the day is our dependency was stripped from us for a reason. You strip people of their dependency, then you gain a profit. You see what I'm saying? Of our own independence. But what happens when you grow your own food and you don't have to go to the grocery store every day, or you don't have to worry about what chemicals are being sprayed, or you don't have to worry about, is this synthetic, is this genetically modified, is this real, is this an animal, is this not an animal, is it 3D printed? You don't have to worry about that when you growing your own zucchini, your own squash, your own tomatoes, your own greens, your own broccoli, your own cauliflower, your own pumpkins, your own apple tree, your own peach tree, your own lemon, lime tree. Start investing in your own stuff. So if they doing that because the population is overly populated, they have to do this. Well, then that's okay. So then my question would be, all right, well, if this is leading to them having to make fake food, how about I start growing my own food? So that because if I'm at this age and they're making fake food, then what does that say to my children? What are they gonna be feeding my children when my children become adults? What does that say to my grandchildren? At some point, when is the solution going to be about our overall health and not about profit? And see, I'm thinking long term. I'm thinking 2-3 generations ahead. So, she says seafood is bad too. Yeah, I agree. McDonald's fries, they can't touch the potatoes for 5 days. Yes, that's see, but they can't. They can't. I never. Oh, geez, they can't touch for 5 days. First time watching you, and I love how you from. Thank you so much. We welcome you, Ring. We welcome you. Beef, pork, and lamb is what you should eat. That's not true. You said should eat or should not eat. Thank you. Shout out to the real. Thank you. Hey, listen. If I have y'all attention, I'm not going to get up here and just feed y'all anything. I'm going to tell y'all the truth and give y'all some knowledge that can help free y'all, and so that y'all can be able to sustain some type of life and longevity to be able to fulfill y'all purpose. You got to cleanse the physical to get to the spiritual. Fungus causes diabetes. Yes, it does. Yes, it does. Thank you. Thank you. Thank you. Okay. We're going to get into some of this, because I'm going through the comments. We're going to get into some of these herbs now. So y'all have y'all pens and y'all papers ready. I love agave. Somebody said, what do you think about agave? I love it. Somebody said, how do you cleanse your blood? We are actually going to be doing a lab on Saturday. So Saturday I'll be doing, oh wait, no. Actually I have an event Saturday. So I actually need to change that. It won't be Saturday. Sunday we'll be doing a lab on blood types as a whole. A, B, O, how to cleanse your blood, proper diet for your blood type, and sickle cell disease and different like blood disease processes. So Sunday, we're going to be going live on Sunday. So make sure y'all follow my page, or y'all can go to my YouTube channel at Higher Levels with Shay, because we will be discussing that, okay? We will be discussing that. All right. So, yeah, she said, can I see the sign behind you? So it kind of cut out a little bit, but it said unexpected weight gain, fatigue, slow healing cuts, frequent urination, increased thirst. So I was trying to get it condensed so that you all could see it like on the page, but for some reason it would not allow me to do that. And the next one was frequent urination. So that's what we'll be talking. So if you are someone who, I'll get to that question. You can purchase small boxes that you can take with you. She says, what if you are renting? So if you are interested, for the person who asked about the blood type, make sure you tune in Sunday to my page. We're going to talk about blood types A, B, A, and B, and O. What does that mean for the blood types? And we're going to be talking about the different disease processes of different bloods, how to cleanse your blood. Okay, so somebody said double tap. Thank you. Somebody said please double tap the screen, y'all. Thank y'all. The double taps really help me a lot. They make me feel like y'all are learning something. When y'all double tap, it makes me feel like, you know, that y'all are appreciating what it is that I am on here doing. And it's not like just I don't know who's just coming in and out or who's actually staying. And so when you double tap, it makes me feel like, okay. So thank you for the person who says y'all double tap. I do appreciate that so much. For the person who says thank y'all, thank y'all. Thank you. Thank you, thank you. I appreciate the blood tap, the double taps. Thank y'all for the hearts. Thank y'all. What I said about the blood type is on Sunday, we're going to be going over blood types. We're going to talk about different blood types, the diets, and how to properly clean it. And we're going to talk about disease process of blood type, like sickle cell anemia. So, like those blood diseases, and how to heal your cells of signs and symptoms of sickle cell anemia, and how to heal cells of signs and symptoms of blood toxic blood syndromes. Okay, so that's what we're going to be talking about on Sunday. All right. Now, for the person who says, what if you're renting an apartment and you can't garden because you don't own a home? Go to Amazon. They have grow bags. Or you can go to your local farmer's market, or like to the dollar store, and get you some grow bags. And with those grow bags, or just get you some flower pots. I don't know how big or small your space is, but I do recommend for you to have a designated area for your, like a designated growing area. And if you can have it like in a sun area where it's a natural window with natural sun, that's great. But if you don't, and you need like a closet space, then get you some UV lights. Get you some UV lights and get you some grow bags. Get you some dirt. You want to get you some well-nourished dirt. You want to get some mushroom dirt, some fertilizer. We'll go through all that when we're talking about growing your garden, like everything that you're going to need, all the different fertilizers, the different soils, why does hay help potatoes grow more, why does sand help carrots grow more. We're going to talk about all that when we do a gardening lab. We're going to talk about all of that. We're going to talk about once you start growing your own herbs, how to dry them out and make tinctures and make your own medicines and your own teas and your own detox concoctions and everything. Later on in the lab, we're going to talk about all of that. So just for simplistic purposes right now, make sure you go on Amazon, get you a grow bag, get you some dirt, get you some seeds. The easiest seeds to grow is string beans and radishes. But grow what you eat. Can't say enough. Don't just start growing a bunch of random stuff because you could. Grow what you eat. And then you're going to put that stuff in the lights and follow the instructions on the back of the packet and start growing your food. I got people who started growing aloe, or get your aloe plant, get your aloe vera plant. Aloe vera plant is amazing for both internal and external. Aloe vera plant helps with diabetes, actually. It helps with detoxing and cleansing the skin. It helps to heal cuts significantly fast. It helps to regulate the blood pressure. Aloe vera is amazing, actually. You see what I'm saying? It's actually amazing. All right. So if y'all are ready, let's go ahead and write down these herbs. We talk about diabetes type 1. We talk about diabetes type 2. We didn't talk about diabetes type 3. Now, really quickly, diabetes type 3 is the dementia. And we talked about because of the brain and how it causes, because when your blood sugar is extremely elevated, as I was explaining, when your blood sugar is extremely elevated, you're overworking the brain. You're the vessels in the brain are, and I'm making this in layman's terms. I can break it down, you know, in medical terms and really go through everything from an intracellular level. But the point of it is, y'all should be able to explain the same information to your children. You see what I'm saying? And so my children know this at a very young age, at elementary school ages. And so your children should be able to know the same information. So that's why I'm just breaking it down to you like this, okay? In layman's terms. But so you got, remember we saw the sticky blood in the blood vessels, which is prohibiting the optimum and adequate amount of blood flow. So that obviously is going to alter the way your brain properly functions, including your memory, which is going to lead to dementia. So what they're finding out in their studies in the medical field is we might as well just call dementia diabetes type 3. Because it's a lot of sugar on the brain that is inhibiting proper nerve function, the neurovascular system, and proper cardiovascular function, circulatory function, which is the blood system to the brain. And that leads to a lot of memory loss. And it leads to brain damage. And it leads to altering your gross motor skills and your fine motor skills. You see what I'm saying? And y'all are doing amazing with helping each other in the chat. I love it. I love the support. I love seeing how y'all are answering each other's questions and helping each other out. We are all one family. That was my whole purpose. And I thank y'all for tuning in. So I do have these medicines, and this is for all types of diabetes, okay? So y'all write these herbs down. We talked about aloe vera. Thank you. Thank you for the gift. Thank you for the flower, LaRonda. I appreciate you. I appreciate you. And if you're just now tuning in, you can find this information on my YouTube channel at Higher Levels with Shay. I will be on KP Radio and KP TV at 10 a.m. Monday mornings. And I'll be on Just Faith TV on Fridays at 5 p.m. where we'll be discussing autism, ADHD, diabetes, hypertension, with dementia, cancer, autoimmune diseases, and more. You see what I mean? Absolutely. Yes. Thank you, Christine. Great question. Christine says, so are you saying that although the brain needs sugar, too much can cause dementia? And that is absolutely correct. Actually, too much of anything could cause an imbalance. Too much of anything could be an issue. And so the same thing where our body needs sugar, but too much of it can cause diabetes. So like our body needs sugar. That's why we got our blood glucose level between 60 and 100 or 80 to 120. And if it's too elevated and our pancreas isn't able to produce enough beta cells to produce insulin hormone secretion, then that is going to lead to us having diabetes. So too much of anything is not good for us. Our body was designed to be balanced. And balance meaning homeostasis. You see what I'm saying? So we're supposed to always be very well balanced in life. You know what I mean? So too much or too little of anything can cause an impairment. And then you will see an impairment by what is known as signs and symptoms. Great question, Christine. She said, I thought dementia was caused by aging. That is a myth. Just because you're aging doesn't mean you're going to automatically get dementia. I know some 97-year-old patients who are extremely sharp. They are a lot more sharp than a 69 person with dementia. So I want to debunk that myth because my grandmother is about to be 90 and she could tell me everything that happened to her as a kid. So, and she's about to be 90 and she's been gardening her whole life. Some of the best collard greens I've ever had in my life. Your next portion says an inactivity of the brain. Absolutely. So inactivity of the brain. Why is there inactivity of the brain? You see what I'm saying? What is causing the impairment on the brain? Poor diet, poor eating habits, and lack of stimulation. Puzzles are amazing. I love Sudoku. What is it? Sudoku. I love stimulating my brain. I love to read. I love doing crossword puzzles. I love overstimulating my brain. I love doing math problems. I love doing science projects. It keeps your brain sharp. I love learning something new. I'm always trying to figure out what more can I learn as my life is going on. As we continue to age, we're not designed to just stop abruptly learning in life. Every single day we should want to know, every single day is a purpose for us to learn something new. We shouldn't be stagnant. We shouldn't be stagnant. So, because see, we want to allow our we want to allow our 8-year-old to still have the mindset of a kindergartner. You see what I'm saying? We want to allow our 15-year-old to still have the mindset of a 5th grader. You're going to be pushing your kids. You're going to be going to school. And so with patients who are not stimulating their brain, or people, as we get older, sometimes we become so stagnant to where we don't even want to learn more. We're sitting in the same job for the past 20, 30 years. We're doing the same routine we're doing for the past 10 years with the same 10 people. We're not stimulating our brain. You see what I'm saying? And so when we say dementia comes with age, it doesn't. It comes with a lack of stimulation and poor eating habits. And that's the truth. That is the truth. She said, what non-dairy would you recommend for your kids? Like, for me, I like those. This is what I do, honestly. You know how you get your fruit and you keep it like really frozen, and then you blend it up with like coconut milk, and it makes this fruity ice cream, but it's not ice cream. It's like a Frogurt, but it's not dairy. You can get like coconut milk, or you can get not almond milk, definitely coconut milk, and freeze it and get like some frozen strawberries, some frozen blueberries. My children love that. They absolutely love that. And it puts them in the manner of ice cream, but it's not ice cream. You see what I'm saying? So they really, really, really enjoy that. They like coconut milk. You see what I'm saying? So I used to do almond milk until I found out that almond milk wasn't what I thought it was. It wasn't nowhere near as healthy as they tried to portray it to be. So I stopped that and I started doing coconut milk. And then I saw a video of how you can make your own almond milk. And so I tried to make my own almond milk, because right now I make my own hot sauces, my own salsas, I make my own bread. And like I said, I grow my own foods, vegetables, and herbs. And now I'm in the process of teaching myself how to sew to make my own clothes. I'm really trying to be self-sufficient and teach my children how to be self-sufficient. I'm thinking generations along, ahead of time. But to answer your question, I made almond milk and I didn't like it. So I think I gotta go retry it again. So I will be retrying again. I will be retrying again. All right. So thank y'all. I love this girl. She's always on my live. The NY Heart. She said, if the world ends, she said, if the end of the world happens, because it will. She says, can I come and stay with you? You are more than welcome to stay on my lives while I teach you how to do this stuff yourself. And I'm going to always be there for you. You can come visit. And we're going to walk you through everything. I won't leave you behind. But I need you. I'm going to teach you how to fish. I'm not going to give you a fish. I'll teach you how to fish. Okay, my sister? So I will never leave you behind. Ever. So just take the knowledge that I'm giving y'all here on this live and just start thinking about how to apply it to y'all life. Now will be the time to start thinking about how to apply this stuff to y'all life. Think about solar panel lights. Think about how to conduct energy yourselves, and that's with a potato, a lemon, and some wires. The lemon is acid. The potato is base. Connected with some wires. With a light bulb, you have light. And we're going to do a science project on that as well. And I'll show y'all how to make light yourself. Okay? So, stick with me. Follow my page. Share my page. And y'all will see how to make light yourself. You will know how to grow your own food, your own cotton, how to spear your cotton and spin your cotton to make your own fabric, So you can make your own clothes, make your own bread, your own salsas, and everything. I got a home watering system that I bought, but I didn't realize that I needed to already have a well in my backyard, and that I don't have, but it's a learning process. So if y'all follow my live, and y'all stay on my lives, and y'all follow my pages, and just share and invite others, go to my YouTube channel at Higher Levels with Shay. I post my videos from my lives to my YouTube. Share it to y'all social media. Don't keep these gems just to yourself. Share a link to y'all family and friends. And you are more than welcome to come and hang out, and I'll teach you how to fish. All right, that way you eat for a lifetime. LaRonda, thank you so much for the gift. Thank you for the gift. I really appreciate that. You're so generous. God bless you. Thank you. All right, so if y'all are ready, we talked about aloe vera already, and aloe vera has a plethora of different benefits. Greater burdock. Thank you. Thank you, Kevin. Thank you. Thank you. I appreciate you all so much. Greater burdock. Ashwagandha. ASHWAGANDA. GADA. I'm sorry. SHAWAGANDA. Ashwagandha. Greater burdock. Agastache fenoculum. That is AGASTACHE. FONICULUM. Fenoculum. And I actually have, if y'all go to my page, I actually have a short that I did on my page for Agastache fenoculum, and I have, because I grew it in my backyard, and I have one for greater burdock on my page because I grew it in my backyard, and I have one for aloe vera. So I started doing that content, but it wasn't getting a lot of likes, so I was like, well, if y'all don't want to know the benefits of these plants, then I stopped doing those. But I may start doing them again. I'm gonna start back putting those I kind of like do a video of the plant, and then I kind of explain the benefits of the plant, what it could do for you. So yeah, so I got Agastache fenoculum, garlic, onion, horsetail, Cascara sagrada. Oops, sorry. Cascara sagrada. Turkey tail, that is a mushroom. Reishi, that is a mushroom. Prickly pear cactus. Milk thistle. Plantain. Cabbage. Bottle gourd. That's bottle, and then GOURD. Chicory, that is CHICORY. Yes, lion's mane mushroom is amazing. Actually, reishi, lion's mane, and turkey tail are amazing for I can't say their word, so I'll say they are amazing for destroying cancer cells. So actually, those are amazing for destroying cancer cells and relieving your cells of cancer symptoms. American ginseng, kudzu, KUDZU, Spanish moss, plantains, yes, plantains, wild ginger, sugar maple, and sweet marjoram, MARJORAM. And you can take these and dry them out and put them in a capsule. You can make them in a tea. You can make them into a tincture, so you have long-standing medicines, or like the longer shelf life. You make it into a tincture or a deconcoction. You could dry them out into just regular seasonings and then put them on your foods, or you can just yeah, And a lot of these herbs, do your research on them, because like I say all the time, I'm just giving you names of some herbs. I do not know y'all medical history. I do not know your allergies. So they do counteract with other medications and disease processes. So make sure y'all doing y'all due diligence on these herbs. All right, do your research, do your research, do your research. All right, like for example, St. John's wort. Pregnant women could not take that. You see what I'm saying? So let's say I say St. John's wort and you're pregnant. Then please do your research before you just start taking St. John's wort, so that you doesn't have a miscarriage. Okay? Or you wouldn't give those to children, because St. John's wort is too strong for children younger than like 8 years of age. So do your research on these herbs. Okay? Before you just take it. Drumstick tree. And then elecampane. E-L-E-C-A-M-P-A-N-E. Elecampane. All right. So we're going to be back. And purslane. That's really good. P-U-R-S-L-A-N-E. Purslane is amazing. It is amazing. So make sure y'all write down these herbs, change y'all lifestyle, start moving towards a healthier diet. Make sure y'all exercising, drink your water. I don't have the list to distribute, like just hand out. That's why I tell y'all to make sure y'all, at the beginning of the live, I tell y'all to make sure y'all have a pen and paper ready. But like I said, if you go to my YouTube channel at Higher Levels with Shay, I will be posting this video. And again, all my past videos are on there. I still got 2 more to post. I still got my autoimmune disease video to post. So, but I got my cancer videos up there posted already. Women and men issues posted up. Reproductive issues posted already. Blood pressure, kidney disease, liver disease, all that stuff is already posted on my YouTube channel. So if you want to go follow my YouTube channel at Higher Levels with Shay, you could do so. You can catch me on KPTV and KP Radio at 10 a.m. Central Standard Time on Monday mornings, where we do interviews with doctors and people who, like grant writers, help you get business and trust funds, building your business credit. We do all that stuff on KPTV and KP Radio at 10 a.m. And then on Just Faith TV, I'm on that TV show at 5 p.m. Central Standard Time for the next 5 weeks, where we'll be discussing a lot of these topics. And then I'm here on this here channel three times a week. I go live, and this Sunday we'll be going live discussing the blood types, blood diseases like sickle cell disease, and how to detox and cleanse your blood, and the blood type diets. So that's what we'll be discussing. So you can follow my YouTube channel, and I will be posting this video, okay? Now, are there any more questions? I hope y'all learned a lot from this live today. Thank y'all for the hearts. I was just going to say double tap the screen if you learned anything. If you learned at least one thing, I did my job. If you learned one thing, I did my job. So if you learned anything from the live, please double tap the screen. Sunday, it will be between... I say 4 p.m. Central Standard Time, but sometimes I'm starting like at 2 o'clock. So just follow my page and just hit the notification button so you can be reminded. Because I say 4 o'clock p.m., but sometimes I start, Higher Levels with Shay. Higher Levels with Shay on YouTube. Higher Levels with Shay. Thank y'all for all the hearts. It lets me know y'all learned something. Take something back so y'all can just better yourselves. And the more y'all follow me, eventually we're going to be leading into the gardening, a lot of gardening tips, how to have your own watering system, how to conduct your own electricity. We all tired of the high light bills, we all tired of the high water bills, we all tired of the high grocery bill, we all tired of the high medical bills. So we're going to talk about how to make your own tinctures and your own medicines. So if you stay with the lives and stay with me, then you'll learn a lot. And it's free information. I'm not asking anybody for anything. Just do the work. Just do the work. So thank y'all for tuning in to Higher Levels with Shay. I will see y'all back Sunday. Go to my page to see some of the content that I did. Oh Oh yeah. Yes, ma'am. Go to my page and y'all will find a lot of comments. So I love y'all. Y'all are my family. And thank y'all for tuning in to High Levels with Shay. I will see y'all next time. Bye. Ooh. There we go, y'all. See y'all.